At PolicyLab, we have our ears to the ground on the ever-changing landscape for affordable health insurance coverage available to the American family. And we are ever mindful of decisions that might be made in Washington or in state houses across this country that might affect the quality of care or the affordability of coverage in these plans.
Over the past few years, we, along with colleagues around the country, have noticed worrisome trends in children's health insurance coverage, trends that have a real impact on kids in our communities. Most importantly, after decades of steady improvement, the rate of uninsured children in the U.S. went up for the first time in 2017.
One of the biggest problems families are facing is that it is getting more expensive for parents to provide high-quality health insurance for their children. An average working family today can expect to contribute over $7,500 in premiums and deductibles alone for their children, not including other out-of-pocket costs for health care. For a family making $30,000 to $40,000 a year, these expenses are unrealistic.
Per new PolicyLab research, many low and moderate income families are now feeling this squeeze and are declining coverage for their children at work. Their alternative has been to enroll their children in their state's Medicaid or CHIP programs, where they can get a comprehensive coverage at a fraction of the cost.
While you might expect this to be particularly true for those who work at small businesses, we also saw a massive migration of children to public insurance among low and moderate income families whose parents work at large companies.
Public insurance coverage rates among children whose parent worked at a large company increased between 2008 and 2016 from 23 to 33%. Today, 1/3 of families working at large companies and 2/3 of families in small businesses rely on Medicaid and CHIP to insure their children.
So really, all these trends speak to the value of these public health insurance programs, which have really become the safety net for the average American working family who can't afford their children's health insurance coverage through work.
And it's happening at a time when some policymakers are actually debating whether to drastically cut funding to these programs.
I think it's our hope that if people really understand the value of these programs, that to the average American working family, that it will give them pause in considering major changes in structure or financing to these programs for years to come.